One interesting presentation that we see of headaches and migraines is that when it first comes on after having a surgery, okay? Now we've seen some patterns over the years regarding this, and it's really only after a number of years that we can pick up a real pattern here. And once the surgeon understands what the reason is, they kind of kick themselves and go, my goodness, why didn't I think of that? And today I'm going to share that secret with you. The reason I'm doing this video is because I actually had a patient that came in earlier this week who reported to me that they had a pretty major surgery. They'd had maybe the odd headache or the odd migraine previous to their surgery, you know, no more than sort of a normal person would get every now and again. But since they woke up from the surgery, they found that they've had these whopping great big headaches pretty much every day, which is escalating to a migraine at least once a week. And last week, it went up to twice a week. So she came to present to me and said, what's going on? What's doing? What can I do to sort this out? Because no one has any answers for me. Well, what I told her was this, is that when I explain it to her what's going on, she's going to kick herself and so is her surgeon. As it turns out, that's exactly what happened. Here is what I think happened, and this is what has happened for a bunch of other patients as well. When you have surgery, okay, surgery is a really, really traumatic process for your body, okay? You're under general anesthetic, you're knocked out, you're paralyzed, okay? And basically you're at the mercy of the surgeon who is, you know, flopping you around the table, moving your arm around, twisting things, pulling things. If it's an orthopedic surgery, often drilling things as well. It's a really quite brutal process to go through. However, what people have actually not thought about when it comes to headaches and migraines post-surgery, it's probably nothing to do with blood pressure, it's probably nothing to do with anything like that. The most obvious thing to consider is the fact that one, you've had a general anesthetic, which means that all of your muscles are knocked out, they're effectively paralyzed for a while. And secondly, the head might be in an uncomfortable position for some length of time, for perhaps hours on end if you've had something very severe like a fusion or a spinal fusion in the back, a hip replacement, or perhaps open heart surgery, okay? As a result of having your neck in a weird position for a period of time, basically when you're asleep, like if you're just regularly asleep and you're in a funny position, you're able to roll over and actually get out of that position. But when you're under general anesthetic, when you're actually paralyzed, when you can't move, there's no opportunity to do that even if you wanted to. So what happens is that when you wake up, when you start moving again, the muscles and the joints haven't been too happy for a little while when you're under general anesthetic. The muscles and joints have tightened up in order to protect themselves, and as a result it refers pain into the head, causing a headache and perhaps a migraine as a result of it as well. And it's amazing how often we have seen this for many, many different types of surgeries. Now, one thing that I need to be very, very clear on is that it can possibly be some complication of a surgery. So if this does happen to you, you need to talk to your doctor, you need to talk to your surgeon and advise them that this has happened, just in case it is something like a medication reaction or something as a result of the surgery. So you need to talk to your doctor or your surgeon to make sure that nothing is missed there. If, however, they're stumped, if they're not quite sure about what's happened, which is the people that come through my door, then the thing to consider is the neck and the position that the neck has been in during the surgery. Because what can happen, as I said, is that you're paralyzed, not able to move, neck's in a bit of a funky position, and basically when you wake up, the muscles and joints have tightened up, and as a result, a headache or a migraine happens after that, which just needs a bit of manual therapy on the neck, a bit of gentle movement through the neck, and generally things respond pretty well. Hey, I hope that little tidbit's been helpful for you today. If you have had surgery and there are headaches and migraines afterwards, talk to your doctor, talk to your GP. If they're not quite sure, all the tests and scans are clear, then it's really important to get your neck assessed because that could be the missing link in the puzzle. Cheers and bye for now.